unless we recognise the symptoms early and that we intervene in a timely manner with perhaps a suspicion of endometriosis from the outset, we're not going to make change in this field. And I'd just like to put a reminder out that there are, at the last time that this was recorded in the medical literature, 176 million girls and women worldwide with the disease, making it one of the top conditions, but one of the least considered as being important for us to take notice of. So in New Zealand, we recognised that symptoms started young, back in the 1980s and 90s. And with my background, I was able to develop a curriculum for a menstrual health program in schools. That started in 1997, making it 20 years old now. And one of the key messages in the ME program, so it's menstrual health and endometriosis, is to actually say, what are the symptoms that might stray from the norm? And then, what can I do about it? Because this is a public health issue. And so we might say, well, things that affect your period. If you're ever in the sick bay at school, if you're ever off school or work because of your period, that isn't a normal period. Hey, mum might have had that, or grandma might have suffered similarly. And in the program we tell lovely stories and we make it fun and interactive, and it integrates into the New Zealand health curriculum. And now we've reached over 500,000 students, boys and girls, between 14 and 17 years. It has had a tremendous impact on young women, on young women's health-seeking behaviours, on the fact that they're a more informed and empowered community. And they can also, in doing that, expect far more from their health care providers. So they want answers. They don't want to be suffering, and no girl or woman should have to go through this because of a monster of a disease like endometriosis and pelvic pain can be. The buzzword around with endometriosis now, of course, is multidisciplinary treatment. And, you know, this isn't the number of surgeons that we can gather around a table. We're talking about what are the other disciplines that we can introduce into this woman's life that's going to make a difference. Because surgery, once she's got persistent pelvic pain, surgery isn't always going to do it. And what is now happening is that, oh, we need more surgery. So we've got someone who might be not even 30 and they've had 15 surgical procedures. You've got to say, like, what? But it's happening, and it's happening far too often, and with each surgical procedure it can further traumatise the pelvis to make the pain worse. So what we need to do is say, let's do best practice surgery, excision of endometriosis, let's make her first surgery the best surgery, and then let's see what else we can do. And I'll give an example, for instance, of a patient I saw in my private clinic, which is EP Coaching and Consulting, quite recently, in the last month. So she presented, she'd had 3 laparoscopies already. She'd had minimal improvement in her symptoms following that. She had significant bowel symptoms. She'd had a Mirena placed. Still things were a little bit dicey. She was feeling really dissatisfied, and by the time she saw me, so gynecologists refer their patients to me. It's a well health coaching clinic in endometriosis and pelvic pain. And one of the very first things I said to her was, what matters to you? If we were to start from today and think, what are the things here and now that really matter? What would you love to change? And do you know the 2 things that she really wanted to make change? She wanted to resume intimacy with her husband because her marriage was falling over, and she wanted to lose weight. Another surgery was booked to check to see whether there was still endometriosis there and adhesions there, and they were going to be removed, and the Mirena was going to be placed, and she thought that that was just what happened. But when we sat down in the EP coaching clinic, we thought, when I was listening to her, I thought, I'm hearing that there might be muscle spasm here, and that in my letter back to the gynecologist, I raised the options that we might be able to introduce for her care. So one was to get some musculoskeletal assessment and pelvic physiotherapy. by someone who understands endometriosis. The next thing was to send her to a exercise therapist, once again, someone who actually understands endometriosis. She didn't like the idea of going to a gym and dressing in lycra. Well, no, we don't all want that. So the other thing that we did was we introduced her, I put to her in a really sensitive way the fact that once you've had 15 years of these experiences, sometimes we just can't climb out of that on our own. And how would she feel about having a clinical psychologist help her with that process? Well, she cried at the thought of somebody was going to help her with that. So all of a sudden we've got some other disciplines that are multidisciplinary. So pelvic pain, pelvic assessment for her muscle spasm. I had a suspicion that it might be that big obturator internus, but I'm not a musculoskeletal assessor, so that needed expertise. The other thing that we had was so exercise, pelvic pain, musculoskeletal, and she was going to pop the surgery on hold. She was thrilled. And we're going to follow her up in 3 months' time and assess how things are going for her and make the next judgment. Now, this was a very compliant patient because she so wanted to get well and wanted those things. We also sent her to a dietitian for 2 reasons. Her extreme bowel symptoms that had not responded to the former surgeries, and which is very common with endometriosis, and a dietitian to talk about the foods that often irritate the bowel in women with endometriosis. And note that I did not say the endo diet, because from my experience and expertise, I don't think there is one. But there are foods which tend to exacerbate bowel symptoms in these women. So I sent her to that dietitian with those 2 things on the list, and then the specialist was able to make those referrals. So at the end of the session, I asked her to put her shoulders back, because women with endometriosis are the most courageous I know, and feel so proud of herself, and so that we really captured that self-love and self-belief again, and she left almost springing down the corridor, which was so wonderful to see, and a part of the reason I do this work.